from Cavite State University main campus and I will be your student nurse for today. So kayo po si?
Neil Brian.
Neil Brian. Ilang taon na po kayo, sir?
16 po.
Kailan po ang birthday niyo?
October 24.
October 24, ano po?
2000 po.
2000 po. So ano pong gusto niyo po itawag po sa inyo, sir?
Brian.
Okay, Sir Brian. Today, I will be going to assess your abdomen to see any abnormalities po sa abdomen niyo po. So, this assessment requires me to touch you po, sir. Is that okay with you po?
Okay lang po.
Okay, so, can you lay down na po, sir? And, pakitanggal na lang po ng gamit po. Okay, thank you po, sir. So, this assessment requires me to inspect, auscultate, percuss, and palpate your abdomen po. So, first things first po is to gather the equipment. So, I have your centimeter ruler to measure the liver span test of my client. I have also here a tape measure to measure his abdominal girth. Also, body-friendly marker po. And then also my stethoscope for auscultating his abdomen. And as you can see, my patient is in supine position. So first is we will inspect your abdomen po, sir. So as I can see po, the color of your abdomen is much paler than the color of your skin tone. And your abdomen is symmetric to each other. And ano po ito, sir?
Napula lang po.
Mapula lang po. So, I can see that you have no striae or stretch marks in your abdomen. And there's no lesions and rashes din po aside from this. And then, a little bit redness from ano po?
Nakamot po.
Kamot lang. Okay, so that's good po. And I can see that the contour of your abdomen is flat. And that's good po since yung medyo palobo po na abdomen natin is dahil po sa mas marami pong fluid na nasa loob ng abdomen. So, the contour of your abdomen is flat and that's good po. Then next is we will inspect the abdominal movement po, sir. May I request you po to breathe normally po, sir. Okay, so as you can see po, the abdomen of my patient, the abdominal movement is seen very clearly and the aortic pulsations here po is slightly been visible po since while my patient is breathing normally po. And then we cannot see the peristaltic waves in his abdomen and that's normal po. Then I have here a tape measure po, sir. We will be going to measure your abdominal girth to see if there is any abnormalities with your abdominal girth po. May I request you po to stand up. So, we can measure the abdominal girth of my client by putting this... stand na lang po kayo, sir. Okay. So, by putting this in the middle or in her umbilical part, here. And then, this. Okay, so as we can see, the measurement of his abdominal girth is 26 centimeter and that's normal po for the male client since the normal abdominal girth measurement is less than 35.5 inches po for the male patients po. So, you can lay down po ulit, sir. So next po, sir, is we will auscultate the bowel sounds of your abdomen. With the diaphragm of my stethoscope po, sir. Okay, so may I request you po to breathe normally po, sir. Magsisimula po tayo sa right lower quadrant of your abdomen. This is the fourth quadrant of your abdomen po. Dito pala po. Okay. is okay, next po is your left upper quadrant. Okay, next is here for the left lower quadrant. Okay, so I can hear your stomach gurgling po, sir. So this is the low pitch loud sound in your abdominal sound in your abdomen po, and that's normal po, sir, since kumain na po ba kayo, sir? Medyo natunog po yung abdomen niyo. So next po, sir, is we will auscultate the vascular sound of your abdomen by using the bell of my stethoscope. Okay. Okay, so I can hear a low pitch sound po, sir, in the vascular sound of your abdomen po, and that's normal po, sir. So next is we will auscultate for the peritoneal friction rub of your liver and spleen. Okay, so nandito po yung inyong pong liver and nandito po yung spleen. Okay, so I cannot hear any friction rub sounds po with your liver and spleen, and that's normal po, sir. So next po, sir, is we will percuss the quadrants in your abdomen, starting from the right lower quadrant here. Okay, so as you can hear, sir, over here, we can hear the tympani sound po. And then with your liver and spleen, we can hear the dull sounds in your abdomen po. Next, sir, is we will perform the liver span test by percussing your abdomen from the right upper quadrant, which is here. And then kapag may narinig po tayong dull sounds, imamark po natin dito. Okay, so bawal po siya dito. Don't worry, sir, because I used the body-friendly marker po. Then from this, pataas naman po. Okay, so bawal po siya dito. Then, we will measure it po with my centimeter ruler. Okay, so as you can see, the liver span of my client is in 6.5 centimeter, and that's the usual liver span of the male client po. Next is we will perform the spleen span test naman po. We will perform the same procedure as the liver, but we will proceed with this part po, sir. So, hanapin po natin yung last intercostal space of the ribs. Okay, which is here. So, and can you inhale and hold your breath po, sir? Okay, so may narinig po tayo ditong dull sounds as well as here. So, upon assessing your spleen span po, I conclude that your spleen ranges from this side lang po and from this size lang po, sir. So, you can breathe out na po, sir. And then next is we will palpate the ear abdomen to see any tenderness and bulges or any masses po, sir. Tell me if it hurts po. Does it hurt po?
Hindi.
Does it hurt po?
Hindi.
Does it hurt po? Okay, so upon palpating your abdomen, sir, I can see that your abdomen is not non-tender and it is soft po, like the usual abdomen of my other client po. Next, sir, is we will try to palpate your kidney po by putting my other hand in the posterior abdomen po here, and then my other hand here po. So, can you inhale po, sir, and exhale? Inhale, exhale po. Next po, sir, ulit. Inhale and exhale po. Okay. So, I can slightly feel your kidney po, but it's not, usually po, it's not palpable po. And same with the other side po, sir. Okay, so inhale and exhale po, sir. Inhale and exhale, exhale. Inhale, exhale po. Okay, so same with this side po. I can slightly feel your kidney, but usually po, it's not palpable din po talaga. So next po, sir, is we will palpate your liver po for the body motif for consistency and for the tenderness po. I will put my other hand here din po. And then here. So can you inhale po, sir? Exhale din po. Okay, so inhale and exhale po. Inhale and exhale po ulit, sir. Okay, so just like your kidney po, your liver is not palpable, and I conclude that your liver is non-tender po. Then next po, sir, is we will palpate your spleen po. Okay, by putting my hand here. And then, inhale po, sir, and exhale. Ulit po, inhale and exhale. Okay, so I can feel here your spleen po. Inhale and exhale po. Okay. So, your spleen is medyo smooth po siya, and upon assessing your spleen point, I can feel that your spleen is non-tender po. And then last po is we will palpate your umbilical area po, sir, here, or your navel part. Okay, so does it hurt po, sir? And I can see that your umbilical area has no bulging, has no lesions, and any masses po, sir. So overall po, sir, upon assessing your abdomen, I don't see anything abnormal po with your abdomen. And thank you for your cooperation po